Well, new at 10 o'clock, health officials are taking important new steps in Salt Lake County. The health department will now provide an effective HIV prevention medicine in its STD clinics. But HIV and AIDS advocates tell our Jeremy Harris that there are still many barriers blocking the medicine for the people who need it the most.
A once daily prescription medicine for adults.
You've probably seen these ads for PrEP. It's a medicine designed to guard against HIV. It's become pretty much mainstream in the last few years.
If taken consistently, it's up to 99% efficacious in preventing HIV.
Emma Afros with the Utah AIDS Foundation says despite PrEP's known benefits, many Utahns are still struggling to access it.
In Utah, it's a little bit different. The landscape is still different. So we are lagging behind other states.
Utah is a tough place to publicly talk about sex and disease prevention. These Utah Department of Health condoms taught us that. But even if a patient wants to get on PrEP, the cost can be steep.
The drug itself, if you were to pay out of pocket, is roughly $1,500 a month.
Lynn Beltran oversees HIV and STD epidemiology here at the Salt Lake County Health Department.
Treatment is prevention now.
The health department is now offering PrEP.
We help them through the entire process of getting...
And PrEP navigators who will help patients with or without insurance look at options for getting on PrEP.
We can offer it for sometimes 1/3 or 1/4 the cost of what it would be in the private medical community.
Beltran tells me some doctors don't have experience with PrEP and may not feel comfortable prescribing it to patients.
PrEP is a fairly new public health intervention, and a lot of medical providers are not familiar with it.
Getting them on PrEP as soon as possible is most beneficial.
Afro says the health department's decision to offer PrEP is huge and hopes it will be a catalyst to connect more Utahns with effective HIV prevention.
Getting to 0 new HIV infections is very realistic and reasonable for us, but the provision of PrEP has to be a really big component to that.
Jeremy Harris, 2 News.